gut feelings do seem to be predictive of cancer. So if a GP recorded a gut feeling with a patient, that patient was then about 4 times more likely to be subsequently diagnosed with cancer than if there was no gut feeling. We also found that there were certain things like continuity of care and GP's experience and how well they knew the patient. So those sorts of things were related to how accurate the gut feeling was. Particularly because some of the triggers of gut feelings are things, sort of non-verbal cues. So the way the patient presents, how they speak during the consultation, whether their body language has changed from a previous meeting that the GP had had with them. And those sorts of non-verbal cues are things which are maybe not as readily recorded in the patient notes. We also found that GPs have difficulty using their gut feelings quite a lot of the time because they are still seen as something that's not evidence-based. They don't have maybe particularly hard clinical evidence to back them up. The more experienced the GP became, the better their gut feeling became. That was what most papers reported. A few also reported that actually newer GPs could also have accurate gut feelings. And those papers tended to talk a bit more about sort of how GPs are taught to pay attention to their gut feeling. And the main difference actually in terms of experience was whether or not they were able to get the people they're referring their patient onto to listen to their gut feeling. So if you're an experienced GP and you're talking to a consultant, that consultant is more likely to listen to you because they see you as an experienced colleague. Whereas if you're newly qualified, maybe that doesn't happen so much.
What does this mean for GPs?
GPs should be encouraged to use their gut feelings. It appears that they are a useful tool. And it also appears that the sort of worries around them not being evidence-based are maybe not all that founded, because it's very rare that a GP has a gut feeling and then just immediately goes on to make a referral. They'll usually do a lot of background around trying to do more tests or build a case for the patient. A lot of gut feelings are triggered by non-verbal cues, which aren't recorded as often or as consistently. And also gut feelings are just not recorded that consistently either in patient notes. So we make the case, or we try to make the case for setting up ways to make sure that gut feelings are recorded consistently. And we also talk a bit about guidelines and how it would be useful if guidelines were more sort of forthright about how GPs should use gut feelings.
What's your key message from this research?
Gut feelings really need to be recorded more consistently, and the non-verbal cues that trigger them need to be recorded more consistently. And if we do that, we can then improve research, and we can maybe go on to include them in guidelines in a way that is more evidence-based